Oopsie! Haven't updated the second part of my tour vlog. I just realized that. That's a little awkward. So a few months ago, if you watch videos on my main channel, you would have heard me say something about missing a video because I went for an MRI. And I was going to upload a video explaining why I was at an MRI. And never did. That's because stuff happened. Originally the MRI was just to look at my sternum. And that was the whole concern. We were going to look at my sternum, find out what was wrong. Turns out I just have a tilted sternum. I was born with it. The muscles don't work correctly around it, which explains the inflammation constantly and the pain constantly and all this other stuff. So, I'm on an exercise routine, and then I have 2 different anti-inflammatory medicines that I take when it hurts. So, there's that. I'm only allowed to exercise up to a certain point. And I went to work my abs, my pecs, and then my arm muscles. Probably not my arm muscles, but I'm just adding that in because it makes sense. So that was that. But when they did the MRI, they, oh, this is so awkward to say on camera. They found some lumps in my breast. And for those of you who don't know, my mom is a breast cancer survivor, and she's going through her battle again, and there are several other members of the family who have had cancer diagnoses in the past few years. And 2 of them actually just recently passed away. So I found all this out in March, April, and I got the call with my MRI results, and they told me that they had found lumps. And the scariest thing was that I was kind of scared that adding another person to the family, if there was just another person got diagnosed, I was just going to tear everyone apart. And so I hung up the phone crying, and I knew I couldn't make the medical vlog about the MRI because I didn't know what was going on. And then I went to a series of doctor's appointments afterwards. I immediately got a doctor's appointment with a surgeon. I was put on rush because of my mom's history, even though it's not genetic in our family from all the people who have done genetic testing. And so we went to the surgeon, and you have to do a breast exam. And I think it was one of the most horrifying and violating moments, having to be completely exposed to someone you just met, a doctor. And they have to have a nurse in the room because the doctor's male, and they don't wear gloves or anything, they just pop their hands on you and feel around. And I mean, the doctor was great. He pretty much told me, just from feeling that he didn't think it was cancer. He didn't think it was cancerous at all, but I still get sent out to do an ultrasound of my breast. And they did that, and it's fucking painful. I don't know if anyone who's watching this has ever gotten an ultrasound before. I don't know if it's different when you get an ultrasound when you're pregnant, but when they went over the tumors, because there's 2 of them, it was incredibly painful. So I went back, and I did another breast exam. This is all in the span of 3 weeks. And he said, we have 2 options. We can remove them, or we can wait and you can come back in 3 months and we'll see what we do then. And it was the beginning of summer, and that's the busy time at work, and I couldn't take time off then. I mean, I could have, but I didn't want to. I wanted to get through the busy season and get into the slower season, which is right now. And so I decided to push it off 3 months. And so I went back for another ultrasound in September, and the tumors grew a little bit. Not enough where they're not really sure if they got incorrect measurements the first time, or if they really just grew in the span of 3 months. And it was just, once again, it was really painful, and it's still a really violating feeling, even though it's for my benefit and it's a doctor. It doesn't take away any of the violating nature of it. And so once they got the results, they told me, at first they said nothing had changed, and then I got a call later that night saying one of them had grown. And then the next week we went back to the surgeon, and I decided to set up surgery. So that's set up for this Thursday. They're going in and they're taking them out because even though they're not cancerous, there is a small chance that they could grow, they could become uncomfortable, or something could happen to them to cause them to need to remove them. So we set up the surgery, and then we started telling family members about it, and I'm telling you guys, because this has just followed my whole medical journey ever since it started with the chronic hiccups when I was 16, and then expanded from that to my problems with my sternum, and now this. It's just been one thing after another. And I don't really know why I'm crying, because I've had months to deal with this, and I don't know. I think I'm just worried that because I got lucky once, I won't get lucky again. And it's a really scary feeling. But anyways, I'm going out for surgery on Thursday. I still don't know what time. It's literally less than 7 days away, and I don't know what time. And then I have a week to recover, and then I go back to work, and everything goes on from there. That's kind of, that's what's been happening. I'm really sorry if we used to be friends and I just didn't message you, I didn't want to bother you with my problem. I only told outside of the people at work, and then family members, which I didn't tell my parents, told everyone, and then my two best friends and a few other people. There's really not that many people that know, but I felt like it was necessary because this whole YouTube channel, big majority of it has been dedicated to my medical life, and I felt like I couldn't really just not tell you. I mean, it's being announced on my main channel that I'm going out for surgery, because the videos for the next few weeks might be a little off, but I don't know. I don't know how I feel. We'll see. But yeah, I think that's everything. Blood work sucks, especially when you don't have a good, what are they called, phlebotomist, and people that stick you with the needle. But yeah, so I think that's all I have to say on the matter. I mean, assumably we're going to be watching to see if anything else comes from it, and there's a small chance that scar tissue leads to cancer, so I don't know. I'm just kind of nervous. I haven't really talked to anyone about it, but I managed to push off my mind for months, so I'm really lucky in that sense that I've been able to have the time to not have to think about it and just focus on work, and now that it's finally, right around the corner, I'm starting to freak out a little bit. I think it's normal though. I don't know anyone who would go into this situation and not be freaked out or be scared of what's going to happen in the future. Especially when it happens in your young. I mean, it is what it is. I'll make it through, and I'll get through it, and I'll be fine. Yeah. I've stared everywhere at the camera while doing this because I didn't want to make this video. And I didn't want to tell anyone. I'm probably just going to upload it straight from the camera onto the channel, because if I don't, it's not going to happen. I know myself well enough to know that. Alright, well, I'll see you guys later. I'll do a recovery video at some point, maybe. Or if anything else happens.